So today we can study some important question from the Kerala Ayurveda Medical Officer PSC exam. Solve question paper, and it is a 2023 question paper, and here we are going to discuss about questions 1 to 50. Which of the following philosophy or darshana or is also known as Tattva Samkhada as well as Tattva Ghanaka? So the options are Sankhya Darshan of Kapila, Vaiseshika Darshan of Kanadha, Nyaya Darshan of Gautam, Yoga Darshana of Patanjali. The answer is option A. Sankhya Darshan of Kapila is also known as Tattva Sankhada or Tattva Ghanaka. So, a small description about the Sankhya Darshana. Sankhya means Sankhya, that is number or knowledge. Upadeshta is Maharshi Kapila. Vartika Karta is Vijnana Bhikshu. Bhashya Karta Gauda Padha. Number of chapters and slokas are 6 chapters, including 527 sutras. And the theories postulated are Satkaryavada, Parinamavada. And there are 3 pramana, Pratyaksha, Anumana, Shabda, Pramana. And there are 25 tattva. Which of the following gunas include under the additionally added 7 numbers of guna by Prashastapada, the commentator of Vaiseshika Darshana of Kanada, to make the number of gunas 24 as per school of Vaiseshika Darshana? So, Rupa, Samyoga, Adrishta, Paratva. Which are the gunas? Prashastapada was an ancient Indian philosopher, and he wrote the Padhartha Dharma Sangraha, that is a collection of properties of matter, and a commentary titled Prashastapada Bhashya on the Vaisheshika Sutra of Kanada. And here, the additionally added is Adrishta Guna. Answer is option C. Vaisheshika Darshana is Vaisheshika means Vishesha Padhartha and synonym is Aulukya Darshana. Upadeshta is Kanada and Vartika Karta is Jagadisha Bhattacharya. Bhashya Karta Prashastapada, number of chapter 10 Adhyaya, 20 Ahnika and 370 Sutra. The postulated theories are Pilupagavada or Paramanuvada, and Pramana is 2 only, Pratyaksha and Anumana. The Padharthas are Dravya, Guna, Karma, Samanya, Vishesha, Samavaya and Abhava. Which of the following scholar considered as oldest preceptor of Yoga Darshana in comparison to Patanjali of Yoga Darshana? Yankya Balka, Hiranyagarbha, Shivaditya, Ishvara Krishna. Answer is option B, Hiranyagarbha. Yoga Darshana referred to the yoga philosophy. The Hiranyagarbha Yoga Darshana is an older tradition of yoga that is considered original. And the teachings of Hiranyagarbha Yoga Darshana are found in the Veda, Upanishad, Gita, Mahabharata, and Puranas. In the opinion, Sankhya Darshana, which of the following is a correct statement? Tanmatras Rupas are the Avishesha in the stage of Mahabhuta. Gunas are quality or remains as Avyakta Avastha, non-manifested in the stage of Mahabhuta. Tanmatras Rupa are the Vishesha in the stage of Bhuta. Gunas, that is a quality, are the remains as not manifested Avyakta Avastha in the stage of Bhuta. And the option D is the answer. In the opinion of which of the following commentary of Sushruta Samhita, Bija Chadushtaya has been described as Chaduravayava? Bhanumati of Chakrabani, Nibandha Sangraha of Delhana, Sushruta Artha Sandibana of Haran Chandra, Nyaya Chandrika of Gaya Dasha. So what are Bija Chadushtaya? It is Vyadi, Purusha, Kriya Kala and Aushada. And Bija Chadushtaya is a fundamental principle in the Sushruta Samhita that is used to treat disease. And this is mentioned, Bija Chadushtaya is described as Chaduravayava in Nibandha Sangraha of Delhana. In which of the following group of chapter, the chapter name as Swastha Vritta Adhyaya has been described in Sushruta Samhita? Tantra Bhushana Adhyaya, Kriya Kalpa Upakrama Adhyaya, Prabhashaniya Adhyaya Upakrama, Hida Ahida Adhyaya Upakrama. This Swastha Vritta Adhyaya is mentioned in Tantra Bhushana Adhyaya. In which of the following principle considered to be comparatively better dietetic principle for the management for adhistaulya? That is a cancelled question. According to Charaka, Kalandara Vibhagatva. Kalandara Vibhagatva is a quality of Gara Visha, Dushi Visha, Jangama Visha or Stavara Visha. Gara Samyogajam cha Anyat, Gara Sapnyam, Gada Pradam, Kalandara Vibhagitvad, Na Tadashu Harandi Asu. So it is mentioned in Charaka Chigilsa Sthana that Gara Visha is Kalandara Avibhagi. Kalantara Vibhagi means delayed absorption of the digestive substance, and this produce chronic toxicity. It is Kalantara Vibhagi. So the answer is option A. Gara Visha. Kalantara Vibhagi. Gara Samyogajam cha Anyat, Gara Sapnyam Gada Pradam, Kalantara Vibhagatvad, Vibhavagatvad, Na Tadashu Harandi Asu. Gara Visha is a variety of Visha which is prepared artificially by the combination of the substance either poisonous or not poisonous. They are slowly metabolized or digested in the body, shows their effects after some time and hence do not kill the person instantly. Two types of Garavishas are explained in our classic as Nirvishadravya Samyoga Kritam, that is a combination of two not poisonous substances. Example, Viruddhahara. Savishadravya Samyoga Kritam, combination of the poisonous material which can be turned as Kritrima Visha. Tankana is the pratyaushadhi for Karaskara, Vatsanaba, Bhalladaga, Chitraka. Tankana is the antidote for Valsanaba. In Ayurveda, Tankana or borax is considered to be the main antidote for Valsanaba and it should be administered along with the ghee and Arjuna for acting as antidote. In modern allopathy, it is the Valsanaba, the antidote is by prevention by decontamination, gastric lavage, cardiac monitoring in intensive care, treatment for cardiac toxicity. Swasti Karodi Anjana Nasye is by Doshi Vishari Gulika, Deshangam Gulika, Vilwadi Gulika, or Lodradi. Yoga. Bilvasya Mola Surasasya Pushpa Karanjasya Nadam Surahwam Palatrigam Vyosha Nishadvayam Chabastasya Mutrena Susukshma Pishtam Bujanga Luda Unduru Vrishchika Adyehi Vishujika Ajirna Garajwaraisha Arta Naran Buddha Vidarshidamsha Swasti Karodi Anjana Pana Nasyehi. In Sarpa Visha Pradesheda Adhyaya in Ashtanga Hridaya Uttarasthana, we can see that Vilvadi Gulika is Swasti Karodi Anjana Pana Nasyehi. A drug that induces or maintains sleep, similar to normal arousable sleep, is sedative, tranquilizer, anesthetic, or hypnotic. So we can see all these things. Sedative is a drug or substance used to calm down a person, relieve anxiety, or help a person sleep. Hypnotics are a class of drug that can help you fall asleep, stay asleep, or improve the quality of your sleep by suppressing the nervous system, central nervous system. Tranquilizer is a substance that calms, soothes, and reduces stress and tension, also used to treat the anxiety and insomnia. Anesthetic drugs are substances that cause a loss of feeling or awareness. So answer is option D. Drugs believed to increase the bronchial secretion or reduce its viscosity, facilitate its removal by coughing. Demulcent, expectorant, bronchodilators, all of the above. An expectorant is a medicine that helps you cough up mucus from your lungs and throat when you have a cough that produces mucus. Expectorant works by thinning mucus secretion in your airway, making it easier to expel from your body. They can be used to treat the congestion from the cold or flu, but they won't stop you from coughing. So, this is reduce its viscosity and facilitate the removal as expectorant. Answer is option B. Bronchodilators are a type of medication that help people breathe easier by relaxing the muscle in their lungs and widening their airway. They are often used to treat conditions like asthma and COPD that cause the airway to be narrow and become inflamed. Demulcent is a mucilaginous or oleaginous preparation that forms a soothing protective film over a mucous membrane, relieving minor pain and inflammation of the membrane. However, they generally help for less than 30 minutes. Soothing medicaments act by relieving pain in the stomach and intestine and expel gas from GI tract by peristalsis are carminative. Digestant is a substance that helps break down food into nutrients that can be absorbed by the body, which in turn support digestion, immune health, and overall well-being. Some examples of digestion are hydrochloric acid and bile salt. Antacids are medicine that contract that is neutralize the acid in your stomach to relieve indigestion and heartburn. They contain ingredients such as aluminium, calcium, magnesium, or sodium bicarbonate, which act as base or alkali to counteract the stomach acid and make its pH more neutral. Carbonated or specifically antispasmodic to the bowel, easing cramping, gripping, and the discomfort caused by flatulence. Uses in flatulent dyspepsia, also to prevent the regurgitation of milk in infant. For example, fennel, coriander, cardamom, cloves, cinnamon, caraway, etc. Antiemetics are medication that treat or prevent nausea and vomiting, and they work by blocking the body's chemoreceptor trigger zone or directly affecting the brain's vomiting center. Pyridoxine is vitamin B2, B3, B12, B6. So this is from this table. These are the water-soluble vitamin B, B1 thiamine, B2 riboflavin, B3 niacin, B5 is pantothenic acid, B6 pyridoxine, B7 biotin, B9 folate, and B12 cyanocobalamin. So from this, pyridoxine is B6 and the answer is option D. Quinine is anti-malarial, amoebicidal, antimicrobial, antifungal. So quinine is used to treat the malaria caused by the parasitic Plasmodium falciparum. So the answer is option A. Simple vaccine is given as simple vaccine is 5% suspension of sheep brain infected with the fixed virus and inactivated with phenol at 37 degrees Celsius, and this is used in anti-rabies. Corona court. This is a cancel question. Let's discuss what is coroner's court. It is a court of law, and the coroners are independent judicial officer who investigate and explain certain types of death. They have the following power, that is summon witness, issue subpoena and attachment, arrest people, administer oaths, and sequester juries of 6 during inquest. The following Ganadravyas are contraindicated during Rasa Aushadhi Sevana Kala. Kakharadi Ganadravya, Kshara Ganadravya, Levana Varga Dravya, all of this. So what is Kakharadi Ganadravya? That is the answer. Group of fruits and vegetables which are advocated as apatya during the Rasa Sevana Kala is known as Kakaradi Gana. They are also known by the name Kaghara Gana, where the total number of ingredients in such crop are limited to 8 only. If it is Kaghara Gana, Dravya mentioned under the Kagharadi Gana or Kaghara Gana are also indicated as antidote for the ill effect of the Parada Sevana, that is a mercurial compound. According to Shargandhara, the quantity of Gugulu in the Yogaraja Gugulu formation is. So, Yogaraja Gugulu is a polyherbal formulation of 29 ingredients in which, except Gugulu, all are taken in one part each. So, the principal ingredient Gugulu is taken 27 parts. This is a cancel question. According to Shargandhara, types of Pradisarana or Manchana are. So, Pradisarana is mainly Kalka Avaleha Churna, 3 type, and used by the tip of the finger in all pieces of mouth Manchana. That is, this is tooth powder. This is also considered as Pradisarana. According to Sharkandara, the length of Anjana Shalaga is 8 angula. According to Sushruta, synonym of Madhu Tailika Basti. This include Yabana Basti, Yuktaradha Basti, Siddha Basti. So all these are synonyms. And what are the ingredients? Madhu, 1 pala, Saindava, 1 karsha, Sneha, that is Tila Taila, 1 pala, Kalka, Shadapushpa, half pala, and Kwada, that is the Eranda Mola Kwada, is 2 pala. According to Chargandhara, during the preparation of the Panadi Kalpana, the proportion of the drug and water is. Answer is option A. 1 pal of crushed drug is boiled with 64 pal of water and it is reduced to half quantity for Panadi Kalpana. According to Vaidyak Paribhasha Pradeepa, collection of animal origin products like Nagaroma, this is a cancelled question. According to Vaiseshika Ratnavali, in Urdhva Chatru Gada Vikhara, that is a disease of head and neck, the avalekya should be given. So, how it is classified? If the patient is having the disease in Urdhva Chatru Gada Bhaga, leha should be taken in evening time with proper Anupana. If the disease is affected to Adho-bhaga, leha should be taken before food. So, here the question is Urdhva Chatru Gada Vikhara and it is evening time. According to Rasaratna Samuchaya, quantity of Kadugi Churna in Arogya Vardhani Vadi. So, Kadugi Churna or Tikta is same. Rasagandhaga Loha Apra Shulpa Basma Samam Chakam. Tribala Dvigana Prokta Dri Gunascha Shila Jadu. Chadurgunam Puram Shuddham Chitramolam Chatat Samam. Tikta Sarva Samatneya Sarvam Sanjurni Yatnadaha. Nimba Vriksha Dhala Ambo Abhimardayet Dvinavadi. So here the tikta is the kadugi. So Shuddha Parada, Shuddha Gandhaga, Loha Basma, Abraga Basma, Tamra Basma, all are samam. That is 1 part. Tripala Churnam is 6 part. And Shuddha Shilajadu 3 part, Shuddha Gugulu 4 part, Chitragamula 4 part, and Kadugi is 22 part. The answer is option A, Sarva Sama to all other ingredients. Okay. So, samchurne yatnada tikta sarva sama jnaya. Bahya Kalpana Chikitsa is included in. You know that is a Bahir Parimarjana Chikitsa. Bahyatama, Bahyatha, Shuddhi Karma, Shuddhi Garam Peshijam. Bahyatha, Shuddhi Garam Peshijam means main area of the Bahir Parimarjana Chikitsa is Twaja. Treatment like Abhyanga, Svetana, Pradeha, Parisheka, Unmardana, etc. according to disease are known as the Bahir Parimarjana Chikitsa. Hedu Chadashtaya of Rajayakshma. Answer is A. Veghavaroda, Kshaya Sahasa, Vishama Ashana. So this is the Hedu Chadashtaya. That is the Rajayakshma, Sahasa, excessive exertion, Vega Sandharana, suppressing of natural urges, Kshaya, tissue depletion, Vishama Ashana, irregular dietary habits. Kasa Beda. Which are the 5 types of Kasa? Vadaja, Pittaja, Kabaja, Kshayaja, and Kshadaja. 5 types. Lohita Gandha Nishwasa is the Purva Rupa. So here, Loha Gandha, Lohita Gandha, and Matsya Gandha is mentioned in Rekta Pitta. Prabhuta Avela Mutrada. So you know that is the main symptom of Prameha, Samanya Lakshana of Prameha. Alteration in the normal characters of urine is seen, which is called as the Prabhuta Avela Mutrada, and this is a cardinal feature of Prameha. And what are the 10 dushyas involved in Prameha? Rasarekta, Mamsamedha, Majja Shukra, Oja, Ambu, Vasa, and Lasika. HbA1c test done in diagnosing, you notice diabetes. H1AB, that is a hemoglobin A1c test, is a blood test that measures the amount of glucose or blood sugar attached to hemoglobin in your RBC. The test shows your average blood sugar level over the past 2 to 3 months. Inverted T wave in ECG indicate. Answer is all of the above. That is the left ventricular hypertrophy, digoxin effect, and the coronary ischemia. An inverted T wave on an electrocardiogram, that is the ECG, indicate that the T wave is negative, meaning the terminal portion of the T wave is below the baseline. Adhoga Rektapitta is Yapya. So Rektapitta Sadhya Asadhyada is Sadhya Rektapitta Urdvagam Balino Avegam Ega Doshanugam Navam Rektapittam Sukhe Kale Sadayet Nirupadravam. Yapya Adogam Yabayet Rektam Yecha Dosha Dvayanugam Shandam Shandaha Punaha Kubayan Margan Margandaram Chayet. Asadhya Rektapitta Adipravartam Mandagnehe Tridosham Dvipadam Tyachet. Vadapurna Dhridi Sparshav joint is the Lakshana in Sandigada Vada. So, Sandigada and Amavada. Sandigada Vada Lakshanas are Handi Sandhi, Sandhi Shula Adaubav Karodi, Sandhi Visleshana, Stampadikam, Vada Purna Dhridi Sparsha, Shoda, Prasarana, Akunjana Yor Vedana. And Amavada Agnimadya, Jwara, Bahumutrada, Vid Vibhatada, Hrudravam, and Vrishika Vyabha Vidha. Iva Vedana. So the term is Vrishika Vyavadha in Vedana in Amavada. Vada Purna Dhriti Sparsha in Sandigata Vada. Kabala Kushta. It's a cancel question. So again we know there are 7 Maha Kushta. That is a Kabala Vadaja, Adumbara Pitta, Mandala Kaba, Rishya Vada Pitta, Pundarika is Pitta, and Vada Kaba is, sorry, Sitma. Sitma is Vadakaba and Kaganaga is Tridosha. And Kshudra Kushtas are 11. Ega, Charmakya, Kidiba, Vibhadika, Alasaka, Charmadala. Ega, Charmakya, Kidiba, Vibhadika, Alasaka is Vadakaba. Charmadala, Dadru, Pama, Vispoda, Shadharu is Kaba Pitta, and Vicharchiga is Kaba. Dengue fever is a dash-borne infection. You know that is a mosquito-borne. Dengue fever is a mosquito-borne disease that causes flu-like symptoms including high fever, headache, vomiting, muscle joint pain, skin rash, and itching. It is caused by the dengue virus, which is carried by Aedes aegypti and Aedes albopictus. Symptoms usually appear 3 to 14 days after being bitten by an infected mosquito, and the illness typically lasts 2 to 7 days. Ama Pravarti in Urdhva Bhaga and Adho Bhaga is referred to as. What is it? It is Vishujika. Pidyamano hi Vadhadya Yugapatena Kobidaha. Amena Annena Dushtena Tadhavavishya Kuruvade Vishtamba Ando Alasagam Chya Avayavando Vishujikam. Adho Ada Uttara Margabhyam Sahasya Vajida Atmanaha. That is because eating an excessive amount of food, vada and dosha suddenly become more pronounced and in association with the undigested vitiated food, causing illness. It triggers alasaka through the blocking of the flow of the food through the alimentary tract. And what is Vishujika? By ejecting the undigested food particle in both downward as well as upward direction. So Vishujika, there is a diarrhea and the nausea simultaneously. And the patient feels an entire body of pain like being pinched by needles. So, Vishujika. Suji means it is needle. Divabalam is the Lakshana of Vadaja Choda Lakshana. Chala Tanutvam. Tanuttvak Parusha Aruna Asidaha Prasupti Harshadir Artir Yudo Animittadaha Prashamyadi Pronamadi Prapididho Divabali Chashvayado Samirana. So the main symptom of the Vadaja Shoda is Diva Bali. That is, this increase during the daytime and often subsides without appreciable reason. According to Sushruta Acharya, Navayasa Loha is mentioned in Prameha Pedaga Chikitsa. Tribala Chitraga, Trikaduga, Vidanga Mustanam Nava, Bagaha Tavanda Eva, Krishnascha Varnasya, Tat Sarvamaikadyam, कृत्वा यथा योगं मात्रं सर्पिर्मधुभ्यां संसृज्य उपयुञ्जीत एतन्नवायसम् एतेन जाडर्यं न भवति सन्नो अग्निराप आप्यायते दुर्नाम शोभ पाण्डु कुष्ठरोग अविभाग कासश्वास प्रमेहांश्च न भवन्ति. So in chapter 12 chikitsa prameha pidaka chikitsidam we can find this sloka. Kanagakshiri Thailam. It is mentioned in Kushta. Main Thailas for Kushta are Kushtai Thaila, Shveda Karaviradhya Thaila, Shveda Karavira Pallavadhya Thaila, Tiktek Shwadi Thaila, Kanagakshiri Thaila. Tarjanam, Trasanam, Danam, Harshanam, Sandranam, Bayam is the chikitsa for Unmada. Tarjanam, Trasanam, Danam, Harshanam, Sandvanam, Bayam, Vismayo, Vismrde, Hado Nayanti, Pragardi, Manaha. So, Tarjana means verbal teasing or threatening, shouting with anger, terrorizing. That is Trasanam, gifts or donation, Danam, gladdening exhilaration, Harshanam, consolation, Sandvanam, frightening, Bayam, astonishing or exhibition of the surprising acts, Vismaya. Restore the mind to normalcy by diverting it and counteracting the cause of loss of memory. So this is mentioned in the Unmada Chigilsa and Charaka Chigilsa Sthana. Sarpirguda Roghadhigara according to Charaka Samhita. Sarpirguda Prayoga is in Shadakshina. Grida has Madhura Rasa, Shida, Sandaniya Mrutu, Sharkara, Vrishya, Kshadakshi, Kshina Kshadahida, Sasneha, Guda, Sharkara. Loha Amagandhi Tikta Amla Udkara is the feature of Grahani. So, what are the signs and symptoms of Grahani? Mala Pravarti, Adi Srishtam Vibandha Drava, Trishna Arojaga Vairasyam, Prasegam Tama Pravesha, Pada Karashuna, Asti Parvaruk, Chardana, Jwara, Loha Amla Gandhi, Tikta Amla Udkara. In Unmada Chigilsa, according to Charaga, dash is mentioned, so this is a cancelled question. In Jwara Chigilsa of Vishama Jwara by Charaga, dash is mentioned. Both Rudra Puja and Vishnu Sahasranama are mentioned in the Jwara Chigilsa of Vishama Jwara by Charaga. Number of types of Udhavarta, that is also a cancelled question. Bala Utsaha, Kshaya Tandra, Manda Agnitam, Mrudu, Jwaram is the feature of Halimaka. Yada tu Pando Varnaha Syadire Shava Pedagaha Bala Utsaha Kshaya Tandra Mandagnitvam Mrudu Jwaraha Stri Harsha Strishu Aharsho Angamardascha Shwasa Trishna Aruji Brahma Halimagam Tada Tasya Vidyat Anila Pittadaha. Indication for Upavasa type of Lankana. It is Avarabhala Avalabhala Roga Vamyadi Vyadi. Following is a Manasa Roga Samanya Chigilsa. It is none of this is the answer of the Manasa Roga Samanya Chigilsa. So thank you for watching my video. Please like, share, subscribe my channel for more updates. Thank you.